Okay, let's look at some strategies that will help us to communicate better with our clients. These strategies, some of them might seem really simple, but they are all going to be very powerful in helping us to communicate more effectively. I've seen several occupational therapists and physical therapists incorporate these strategies really successfully when working with their clients. Let's take a look at what some of them are. The first thing we want to do is think about our spoken language. Um, we want to use clear, simple sentences. This one seems like a no-brainer, but it actually requires some thoughtfulness. As professionals, we have technical language and lots of information we want to share so that we can help out our clients. We need to remember to keep it simple without talking down to our client. Another thing we really want to do is slow down. Once again, this one seems like a given, but it's a lot harder to do than we would think. The proper way to slow down your rate of speech is to pause just a bit more between words and pause longer where you would naturally take a breath. So a good way to think about this is to try to imagine where commas and periods would go in your utterances and pause a bit longer at these places. This way your speech still sounds natural and you're not distorting your actual words by slowing the way you say them. This is especially important when working with those who are hard of hearing and who use speech reading to aid with their communication. A third thing we want to do is allow extra processing and response time. In general, people are uncomfortable with silence and we try to fill it. However, one of the simplest things we can do is allow extra time for our patients or clients to respond. This is especially true for those with processing difficulties or difficulty with word finding. And then we want to remember to phrase our questions carefully. The way we phrase the questions can make a difference in how well our clients understand us and in how easy it is to respond. Questions fall on a difficulty continuum. WH questions are the most difficult to process and they require the most complex responses. Multiple choice questions are easier to answer than standard WH questions since the patient does not have to come up with a response completely out of the air. Providing choices is one of the most powerful things we can do for a person who has difficulty communicating because it gives that person an element of control and because it allows them to communicate without having to search for the word. And then yes/no questions are the simplest. They require the least processing and only a single word response, and they don't even really need words to respond. You could just use a simple nod of the head or head shake. Another thing we really want to think about is proximity. We want to be within a few feet of your client. You don't want to shout across the room. This will allow your client to be able to hear you better and it will help eliminate distractions. If you're standing across the room from your client, if your client has attention issues or issues with focus, you have a whole room full of distractions between you and them. For clients who have voice concerns or trouble breathing enough to support a strong voice, it will make it easier for them to communicate with you. They won't have to work as hard to be heard. You also want to get to your client's level. Make sure your client has a clear view of your face whenever possible. If your client is standing, stand. If your client is seated, crouch down or sit next to them so that you're not talking down at them. This is polite, it conveys respect, and it also allows your client to be able to more easily pick up on cues from facial expressions and body language. And you want to make sure the lighting in the room provides a clear view of your face. Another strategy that is used often with children with developmental disabilities is the use of signs and gestures. Simple signs can be taught for requests such as food, drink, help, play. Music is one that's taught frequently, and they can be used to facilitate expression. The signs can be used as a communication system in and of themselves, but for people who hear, they often facilitate spoken language. Gestures are another way of facilitating communication. Encouraging gestures such as pointing or signaling for an activity to stop can supplement an individual's expression. Using gestures when you are speaking can help them to understand. So, for example, if you're offering a drink, you could point to the water fountain that's in the room, or you could make a gesture like you're drinking from a cup, and they'll have that visual cue as well as the word, and it will help them to understand better. This video shows a little boy who has learned some signs to have his basic needs met. He's demonstrating that he understands what his mother's asking when he signs appropriately, and he's also beginning to talk some as he signs. So let's take a look and see what he does.
Hi. Okay, so Liam is learning some signs, and right now he knows 10 signs, and so I just want to... He knows...
He's gesturing appropriately
Liam,
for up.
Okay. What's the sign for more? Good job. How about eat? What's the sign for eat? Good. Help. Help. Very good. Please? Can you show me the sign for please? What's the sign for please? Very good. How about the sign for up? Up. Very
Hear
good.
how he starts talking as he
Water.
signs.
Water. Very good. All done. Can you show me the sign for all done? Good. All done. How about...
Okay, so that's the idea of using signs. You could use signs in an occupational therapy session if you jump on a ball, and that's an activity you do a lot. You could use the sign for jump. Help is a really great sign to teach. All done is another really great sign to teach. And by giving your client a way to express these things without necessarily having to talk, you're allowing them a little bit of control, and you're once again you're showing them that you care about what their wants and needs are. Visual cues are going to be another really powerful strategy that we use. Visual cues are cheap. They don't require any specialized technology. They're portable, and they can easily be incorporated to use with spoken language. The less abstract the visual cue, the less difficult it will be to understand. The more abstract the visual cue, the more difficult it will be to understand. The most common visual cues that we use are objects, photographs, pictures, and text. Objects are obviously the least abstract, and if you have the object in front of you, then your client doesn't have to think about what it is you're saying to them. They can see it. Photographs would be the next less abstract thing, and then pictures, and then text with no picture at all is the most abstract, and it would assume that your client can read. Let's look at some ways that we can use visual cues in our sessions or with our patients. These are the 3 ways we have of using visual cues that we're going to discuss. As visual schedules, and we'll look more at visual schedules in a few slides, as offering choices, and as a tool for your client to express wants, needs, and feelings. Let's take a look at what a visual schedule is. A visual schedule will actually take the steps of procedure and put a picture or a word for each step. So for example, if your client every day when they come into your session, the first thing they do is jump on the ball, and then they sit down at the table and do some work, and then they get to pick a toy that they can play with if they're a child. Then you might have a picture of the ball and a picture of your table, and then a picture of the toy that they would best like. Visual schedules are powerful because they provide a way for clients or patients to predict what is happening in their day or a certain part of their day. And for people with autism or people who have had some sort of head injury, knowing what's coming next can be a big thing. It provides them a little bit of orientation. They can also offer motivation to get through a difficult task by seeing that a task that they like will come next, or they can make a complex task easier to complete by showing the necessary procedure. So for people who have difficulty following multiple step directions, or who have difficulty remembering what will come next in a task, the visual schedule can show them and they can look at it and refer back to it. Offering choices is another way that we can use visual cues. If you have a visual cue to represent choices for food being offered, possible therapy activities, clothing the person would like to wear, you're facilitating your client's ability to understand the question. So if you're asking, what would you like to eat, and you have pictures of food, then you're helping them to understand what you're asking of them. And then you're also providing the means by which they can respond, because they can look and say the name of what they want, or they can look and point to what they want without having to come up with a word by themselves. And what you're doing by offering choices is also allowing your client to have a little bit of control, and that can be a really powerful thing. A lot of the people that we work with don't have much control over what happens in their day. So by offering choices, you have control over what the choices that are being offered are, but they have control over what they're going to pick. And then finally, we can use visual cues as a tool for the client to express wants, needs, and feelings. A classic example of this is the 1 to 10 pain scale with the face drawings that's seen in hospitals. Or a patient could point to a place on a doll where he or she is experiencing pain. Clients could point to pictures of food on a menu to make a choice for a meal. And digital cameras make creating visual cues easy. An occupational therapist I know took and printed pictures of some of the therapy activities she used the most and used the pictures so that the client could express the ones that they wanted to do. Um, so those are just some of the ways that we use visual cues. And we'll take a look at more of the things we can do with visual cues as we look at each disability that we're going to discuss in the coming weeks. Here's an example of a child learning to use photographs to communicate. He is using the photographs to communicate what he wants to eat. He's just beginning to use this system because his mom pulls the cucumber out for him and then he just has to match the picture to it. And then her reaction kind of indicates that she can't believe he did it, so it's just kind of a beginning thing to him. But eventually, he would just have those pictures on the fridge, and he would go and pick the one that he wants and give it to his mom.
Jake,
Also notice that they're photos.
what's this? What's this? Look, Jake, I've got cucumber.
So he picks the picture of the cucumber,
Cucumber, good
and she gives
boy.
him what he asks for. And she can't believe it. This is an example of a visual schedule. Um, this client, after they get home, they pick up their toys and they pick up their clothes and they do their homework, and then they get to watch TV. So they know exactly what's coming up and in what order they're supposed to do it, and they would move the pictures into this all done box as they complete each task. And they can see that the preferred task is at the end, so after they do everything else they need to do, they get to do something they enjoy. This is one that explains getting ready for school, and as they finish the task, they put the little smiley face down, and then they know when they're done. You could use pictures to offer choices. You could have a picture of the therapy ball or the swing, and you could say, do you want to bounce on the ball or do you want to swing? And by holding up the pictures, your client's going to understand better what it is you're offering them, and then they can let you know what it is that they want. So you're facilitating both their understanding and their expression. They can tell you back the word, or they can just point to the one that they want. So when you allow your client to express their wants and needs, when you have the objects, photos, pictures, or words for them to look at, you're allowing them to communicate without having to speak. We talked about pointing to the doll. We talked about having the pictures. So all of these ways are facilitating communication, and they're building your relationship and building your rapport with this client without necessarily them having to talk and without you having to do too much talking um, or do anything really fancy. And then finally, technology is a really fabulous way that we can help facilitate communication with our clients. Some clients will come in already with an alternative and augmentative communication device or AAC device. If they do, it would be appropriate for you to learn how to use it and to ask the speech language pathologist working with that client to help you program pages for your therapy sessions. This way, your client has the vocabulary to interact with you right in their device. Um, some clients will not come to you with those, and you'll be relying more on the other strategies that we've talked about. Emailing and texting can be a really great way to get a hold of a client rather than talking on the phone. An email is kind of a permanent thing, or a text, so your client can look at it. They can take as long as they need to process it. They could show it to someone else and ask them to help them with it, and then they can respond to you when they're sure they understand. And then apps. There are generic apps for communication that are cheap and some are free. They can be found for both Mac and Android operating systems, and they cover the basic needs and are easy to use. These are a few of the apps I found when I Googled communication apps under $10, and really they're just a very few. iConverse, whoops, let's go back. Talk to Me 100 free, My Own Voice, Picture Talk, My Talk Tools Lite. These apps basically cover your basic needs. They have foods in them, they have drinks in them, they have I need to go to the restroom, they have feelings in them, so that just by clicking on the button, your client can let you know what it is they have need of. Those are just a basic overview of the strategies we'll be looking at more in depth as we go through week to week with the specific disabilities.